Hello, I am Dr. Jayanth Reddy. I am the team lead in the Department of Hepatology, HPB Surgery and Multiorgan Abdominal Transplant at Manipal Hospital's Old Airport Road, Bangalore. So on the day of the liver transplant surgery, the patient is taken into the operation theatre. The anesthesia is a general anesthesia. So once the anesthesia is administered, the patient is completely sedated and anesthetized. The surgery for the recipient is usually done by the open route, where a mirror L-shaped incision is made and the liver, which is located higher up in the right upper quadrant, is removed. By the time we are ready to remove the damaged liver, the donor's liver would have arrived in the operation theatre. It is subjected to bench surgery, wherein we clear the donor's liver of all the blood, and with using special solutions, we keep it in ice and sometimes do a bench surgery to reconstruct blood vessels. Then this liver is transplanted into the recipient. So during the transplant process, which lasts anywhere between 6 to 10 hours, there are important joinings that are done. There are, for the first joining is the blood vessels that carries blood away from the liver, the hepatic vein. Then there are two blood vessels that carry blood into the liver, which is the portal vein and the hepatic artery. These are joined. After that, we do ultrasound scan within the operation theatre to ensure that there is good blood flow to the transplanted liver. Once we are satisfied with this, the final joining, that is a bile duct, is done. So this surgery can last anywhere between 6 to 10 hours, depending upon the type of transplant. At the end of a transplant, depending upon many factors, some of which it is how the liver is working, how the surgery itself went, how many blood products were transfused during surgery, a decision is made by the anesthetists and intensivists whether to wake the patient up from surgery in the operation theatre or whether to shift the patient on a ventilator to the ICU and subsequently take them off from on the ventilator after about 12 or 24 hours. Following the completion of transplant surgery, the patients are shifted to the ICU. They are managed in the ICU for about 3 or 4 days, where they are monitored around the clock by a team of intensivists. And after about 4 days, when the patient is fit enough or suitable, they are then transferred to the ward. In the ward, they spend an additional 7 to 10 days, so total hospitalization of about 12 days to 14 days in the hospital. And by the end of it, most patients are fit enough to be discharged. After discharge, we regularly follow them up for the first month quite intensively, where they have to come into the hospital twice a week. The second month, the follow-up comes down to about once a week, and by the third month, the follow-up is about once in 2 weeks, and then subsequently once a month. These patients have to be on regular follow-up for life. They are on medicines for life. The number of medicines is usually more for the first 3 to 6 months. Generally, by the end of 6 months to a year, it comes down to maybe 2 or 3 medicines that they need to take for life. And they have to be under the constant supervision and follow-up of a team of hepatologists and transplant surgeons.